I'm sorry that I cannot be with you for the European Public Health Conference in Milan, and I hope it will be possible to make up for that in the near future. Hopefully, the celebration of the 50th anniversary of ASPR next year might be an opportunity to that end. Andreas Temper has been an innovator performing in both academic work and in the organization and the practice of public health. He has been involved in the development and the implementation as a leader in his community in Zagreb and in his country. Moreover, his commitment in international work has led him to participate actively in the redaction and the preparation of the declaration and the constitution of WHO in 1946. Later, 2 years later, in 1948, he was chosen to chair the first WHO Assembly meeting. In accepting this model, I accept to continue to follow the path laid out by Andreas Temper. As probably many of you, I am presently involved with my colleagues in Quebec and in Canada in considering the future of public health in the present socio-economic and political context. Health promotion and protection, and also the prevention of acute and chronic diseases, are seriously threatened in the context of economic constraints, financial crisis, and social disasters. The pressures on the policy actors and the decision makers in the allocation of resources tend to prioritize crisis management and short-term measures. The disinvesting in public health measures and in interventions for the improvement of the population health will surely increase the pressure on the healthcare system and also increase the burden of disease on society. In the next few minutes, what I would like to do is to share with you some of the thoughts and proposals to be considered for the next decade. These are inspired by working groups in Quebec and Canada, and also by international reports, such as the WHO Commissions of Health Determinants in 2008, the European Health Report in 2015, and the recommendation emerging from the previous European Public Health Conference in Europe, and also many others document from OECD, the World Bank, and WHO. So I will present and summarize my comments around 3 topics: the strategies to reduce health inequalities, the levers for change, and thirdly, the challenges for School of Public Health. To reduce health determinants, we should consider at least 4 strategies. The first one is surely to tackle the social determinants. And to that effect, we have clear recommendations by the WHO Commission on Social Determinants. 3 major recommendations. The first one is to act very early in life to improve the living conditions and to support child development. Secondly, to tackle inequalities in the distribution of power, money, and resources. And finally, to measure the problem and to evaluate the effectiveness of the action taken. The second strategy is in the intersectoral global action. Because to tackle social inequities, all the sectors of government should be involved and coordinated in the same plan. That includes environment, education, transport, food, and so on. And they should be committed in a global plan of action to converge towards the same goals. Thirdly, from the global level, we need a territorial local integration of services and actions. And all the socioeconomic partners should accept to coordinate their joint action and also to share resources. And finally, it's very important to have a consistency between global and local plan of actions. And to achieve that, 4 elements are very important. First, we need a shared vision at all levels. We need agreed targets, a common agenda, and finally, the measurements of the results. The strategies that we have considered do need some levers, because change is necessary, and without levers, it's very difficult to obtain change. The kind of levers we should consider have been the results of different studies and research made by the group of people working with the Canadian Foundation for Health Improvement. And they are the following. First, we need a population approach, not only to improve the accessibility to health services, but we need to outreach the vulnerable groups in the community. And we need to develop a complete continuum of services, starting with health promotion, health prevention, health protection, and accessible, appropriate local levels services in health and social activities. Secondly, we need to engage all the stakeholders. Change does not come from structure, it comes from the people. People have to accept the change and have to decide that they will follow the plan which has been proposed. And that includes, of course, the organization themselves, the professionals, the managers, the patients or the users of services, and the citizens. The participation of the population is very important so that all the stakeholders are engaged in the change. A third level is really to be able to act on evidence-based decision. And I think that the School of Public Health, the universities, and other research centers have to commit themselves to provide evidence to support the decision making. And finally, it's important to have health policies for health and well-being that rely on the capacity building that we develop into the system. Capacities for the organization, for the management, for the professional, and also we need to develop capacities. It's important to support and coach the people to make sure that we have a constant adaptation to the changing environment and to the changing needs. And finally, to really develop a public health perspective for the next decade, the School of Public Health have a major role to play and important challenges to confront. The first one is surely to maintain the excellence in the areas where many successes have been accomplished in the past. We can think for a few examples, such as maternal and child health, accident and trauma preventions, drug abuse and alcohol preventions, cessation of tobacco, and many others. Well, conditions are changing, and it's important to be very keen to improve the resources, the knowledge, and the performance of our action. Secondly, it's important to develop the knowledge and competence to support the multidisciplinary and intersectoral actions on health determinants. This kind of approach does not come easily by itself. The training of people has to take that into account and prepare people to work differently. Thirdly, we need to contribute the School of Public Health, to developing the mechanisms for collecting, managing, integrating, and transforming the data into information and furthermore into knowledge. And finally, it's important to improve the methods to transfer knowledge and to disseminate the experiences. If we can achieve that, I think School of Public Health will be and prove to be a leader for the next decade and change the pattern, probably, hopefully, for the next century. I thank you very much for your kind attention, and I wish you a very fruitful meeting, and hoping again to be with you next year.